Good morning, ladies and gentlemen. Welcome to this first virtual Knowledge Worth Having series organized by the Catholic Gymkhana Limited. Ladies and gentlemen, you may be aware that every week the Catholic Gymkhana brings to all its members and guests a musical members night live program which is streamed through our own YouTube channel, the Catholic Gymkhana YouTube channel. This morning, we're doing something very different. Technology has advanced. This morning, we will be using two mediums of communication, Zoom and YouTube. Effectively, we will be streaming live into Zoom, and from Zoom, we would transmit it on to our own Catholic Gym YouTube channel back into your home. This is the first time, ladies and gentlemen, that we will be using two different channels of communication integrated together for your convenience. We've done this so that we have a beautiful interactive session. I'll use this opportunity to congratulate the Catholic Gymkhana team, and most specifically, two individuals, Ian Pereira and Aubrey Chatelier, for their special efforts in bringing this technology together. Before we begin, ladies and gentlemen, a word of caution. If at any time we lose internet connectivity with either me, the moderator, or the speaker, Dr. Akshay, please hold on. Do not switch off your sets. The speaker or the moderator losing connectivity will be back with you in a few seconds. All you need to do is just hang in there, and we will be joining you if we lose connectivity. Let me give you a glimpse of what is expected this morning, ladies and gentlemen. We will spend the next 100 minutes together. We will start off with the President's introduction of the speaker. That will be followed with a discussion with our very own speaker. Thereafter, we will take questions from the viewers. And finally, we will end with a vote of thanks. I'd like to inform all our viewers this morning that those of you who are interested in asking a question, please pose your question on YouTube chat. Our control room, which is manned by Aubrey and Ian, will collate all of these questions together, transmit it back to me as the moderator, and I, in turn, will pose these questions to our speaker, Doctor, at the very end. These question answers will be posed to Doctor at the very end and not in between the show. However, ladies and gentlemen, you can keep posting your questions right through or keep your questions for just the end. But remember, the moment we finish with the introduction or the moment we finish with Doctor's original presentation, we will get on to the question answers straight away. So let's get going, ladies and gentlemen, promising you a very interesting 100 minutes ahead of you. At this moment, ladies and gentlemen, I'd like to call upon our very dynamic president, Mr. Vernon Miranda. Ladies and gentlemen, the heart behind this, the thought behind this, our president, Vernon Miranda, will now introduce our speaker this morning. Inviting our president, Vernon Miranda, to introduce the speaker, please. Over to Vernon.
Thank you, Sanju. Dr. Akshay Phalak, dear CG members, guests, ladies and gentlemen, good morning, everyone. On behalf of the Managing Committee, it is my pleasure to extend a warm welcome to all of you who have taken your valuable time and joined us today to be a part of this knowledge worth having seminar, an initiative of the Catholic Gymkhana Managing Committee. We are honored to have you all with us. When the pandemic hit the world and we went into a lockdown, our prime concern was to maintain our connect with you, dear members. Our three main avenues were our CG newsletter, the Members' Night, and the Knowledge Worth Having seminars. Thank you, dear members, for your messages of appreciation and support to us during this period. I wish to thank our communications team, Yvette Malgi and Ian Pereira, for their efforts to make our communications with members interesting and effective. Thanks to our entertainment and technical teams who have established great success, attracting viewers from various corners of the world and taking the CG brand global. Thank you, Dominic, Yvette, Sanju, Aubrey, Ian, Leslie, Everilda, Ralph. This established the platform for us to venture and continue with the knowledge series from where we left off. Thank you, Aubrey and Ian and Sanju, for making this virtual initiative possible. Thanks also to Vernon Narona for his promotional initiative. The topic for today's discussion was chosen keeping in mind the immediate concern of society. Ladies and gentlemen, it is a great pleasure for me to introduce our speaker, Dr. Akshay Phalak, Medical Officer, Municipal Corporation of Greater Mumbai, who will enlighten us on home-based COVID care. Dr. Akshay did his MBBS from Nair Hospital, being in the top 5% of his class. He is the winner of multiple national and international clinical quizzes. Dr. Akshay has done his surgical training at Jawaharlal Institute of Postgraduate Medical Education and Research and MRCS, Edinburgh. He has conducted a national level organ donation campaign, getting over 2,500 individuals to pledge as organ donors. He is also associated with an NGO called Sneha, which provides virtual clinics for expecting mothers in the slums of Mumbai. Dr. Akshay is a King's Scholar visiting Guy's Hospital, London. We are grateful to Dr. Akshay Phalak for accepting our invitation. I am sure this interactive discussion will enlighten all of us and provide us with approaches to deal with the problems of COVID. Ladies and gentlemen, I present to you Dr. Akshay Phalak. Over to you, Sanju and Dr. Phalak. Thank you.
Thank you very much, Vernon Miranda, for that beautiful introduction of our speaker this morning. Ladies and gentlemen, we will now move over to our speaker, Dr. Akshay. Firstly, thank you so much, Dr. Akshay, for your very valuable time and welcome to the show.
Thank you.
Let me straight away begin off, Doc. I think it would be right for us to set the tone for this discussion. Doc, if you could begin off by explaining to us the various technical terms and terminologies. We have been flooded with so many of them during this COVID period. And sometimes it gets very confusing for us as lay people. If you could explain to us the various technical terms and terminologies used, I'm sure our viewers would be able to relate to all that you would be saying right through this morning. So in very simple terms for us, Doc, could you please set the tone by explaining these terminologies to us?
Yes, of course. Thank you, Sanju, for the kind introduction. And I'd like to thank all the viewers for tuning in because the session aims to tackle misinformation and help you to present early at the hospital or to your treating physician, because you should know when to do what actions you need to take, what steps you need to follow. So for that, I'd like to thank Mr. Vernon Miranda and his whole team for coming up with this idea. So coming back to your question, yes, there are many technical terms which are used here and there in the media, in the WhatsApp forwards, and you should be aware of those. So the most important term we'll start off with that is SpO2, right? So what is SpO2? It's saturation percentage of oxygen, which means that it basically means the blood oxygen level, right? So saturation percentage of oxygen is the blood oxygen in your arteries, the oxygen which is used by your organs to make energy from. And if that is less, and I'll tell you the exact value, if that is less, then it's a problem for you and you require oxygen support or admission, right? So the second most important term, a set of terms, is inflammation, steroids, and CRP. So let me show you a slide. Actually, I'll share a slide. So this is a statement which is made by a very reputed institute. Can you see my screen?
I guess it will come up, Doc. Yeah, I think, yes. There you are.
Yeah.
Yes, we can see it now, Doc.
Yeah, so this is a very important statement which is made by the East Virginia Medical School. It says it is essential to recognize that it is not the virus that is killing the patient, rather it is the patient's overactive immune system. The flames of the cytokine fire are out of control and need to be extinguished. So what does this mean? This means that, yes, agreed that this is the virus which starts the whole process. But, our body has WBCs, white blood cells, which function to combat any infection. So since this is a virus, it's a viral infection. But what happens in COVID is that when the WBCs fight the virus, there is a process called inflammation which ensues. And it is during this process, inflammation, that the respiratory membrane, which is responsible for transferring oxygen from the lungs to the blood, may get damaged. And when this respiratory membrane is damaged, the exchange of oxygen from the outside, from the lungs to the blood, is hampered, right? So it is this inflammation which needs to be controlled during COVID, so that the respiratory membrane is intact and there is an efficient exchange of oxygen which is possible, because the blood needs to have oxygen. And if the respiratory membrane is hampered, then there'll be no exchange. So yes, inflammation is that process, which is the byproduct of WBCs fighting the virus. Then there is steroids, which is I think everyone knows about steroids by now. But what we know about steroids is what is important to understand. So steroids are drugs which reduce or which prevent inflammation. So they form the cornerstone of treatment in COVID. So as I said, that we need to stop inflammation to progress. We use steroids to prevent or reduce inflammation. Then what is CRP? Now there's a big confusion going on between CRP and PCR. So PCR is the polymerase chain reaction. It is a test which is used to detect COVID. As we say, RT-PCR, real-time polymerase chain reaction, right? So that is completely different from CRP. CRP is C-reactive peptide. So what is that? That is an indicator of the inflammatory process, right? You can't go into the lungs and see what's going on. So what you do is you draw blood from your veins and you test the levels of CRP. If CRP is high, it means that there is inflammation going at the level of the lungs, right? So these were the three most important terms: inflammation, steroids, CRP. I told you about SpO2. Now what's left is D-dimer. As we know that in COVID, there's a tendency to form clots in the blood. And whenever these clots lodge in small blood vessels, the blood supply, after that clot gets hampered, right? Just imagine a pipe and there's a blockage in the pipe. So water won't go beyond that blockage, right? In the same way, if there's a clot and if there's a blood vessel, the blood won't reach and effectively the organ will, suffer. So what we do is, again, we draw blood and we test the D-dimer level. So D-dimer level, if it's high, whatever the normal range is, if it's higher than that, then it means that there is a coagulation process going on in the blood and we need to use anticoagulants, drugs which reduce the coagulatory process. Just like we used steroids, which reduce the inflammatory process, right? So two important things: inflammation, coagulation. How do we reduce? Steroids, anticoagulants, right? But when to use it and how to use it, for how long to use it, we'll talk about it as and when we go ahead. And the last and the most important thing, which I've experienced while talking to so many patients, is that CT value in RT-PCR and CT value in CT scan. This is a very confusing thing which many patients complain about, is like CT value in RT-PCR is something which is not a reliable indicator of the viral load, which means that you can't effectively say how much virus you have, looking at the CT value, because it's not because if you do it in one lab and if you do it in another lab, it's not the same. So you can't rely on that value, nor have any experts or scientists said that CT value should be corroborated with clinical progress and so on and so forth. So what you must be careful about is the CT value in the CT scan, right? Whenever you get a CT scan of your lungs, you're given a CT score, right? The CT score, not CT value. CT value is for RT-PCR. CT score is out of 25, and it indicates the severity of the infection, right? So if your CT score is above 12, then it means that you're suffering from moderate COVID, not mild COVID. As we all know, the treatment for moderate COVID and severe COVID is oxygen support, and in severe COVID we give ICU admission if necessary and ventilatory support if necessary. But if it's mild COVID, less than 12 out of 25, along with other signs which I'll be talking about, then we can just go for home isolation and there's no requirement for oxygen. So in short, these were the terminologies which you need to know. If you are confused, you can, I can repeat it. You can post your questions in the thread, or you can just go back and watch what I said.
Thank you, Doctor. That makes it really simpler for us to take on the rest of the questions this morning. Doctor, in the COVID world today, we hear of various symptoms. And the symptoms that we hear in the COVID world are very similar to the symptoms that we actually experienced before COVID came into being. Now, the confusion with most of us as viewers is that these symptoms existed before. So how is it that we would be able to ascribe some of these symptoms to the COVID problem itself? one would tend to believe that this is a normal symptom which we experienced before. How would we ascribe it to COVID proper?
You're right. Because the most common symptoms, fever, cough, throat irritation, are very non-specific and existed even before. So you're right when, many patients do come and say that how do we identify? So there is this wonderful slide or infographic, as we call it, which is used to, I'll just share my screen.
Sure.
Yeah. Can you look at this?
Yes, it's visible to us, Doc.
Yeah. So these are the most common symptoms which a COVID patient may suffer from. And so the most important thing, as it's written on the top, is recognize day one. COVID is a very time-bound disease, and time is the game changer, as we say. So if you identify your disease on the day one of illness, it becomes very easy for us to, assess the progress and know when is day 5 or when is day 6, because it is on day 6 when things start getting worse. And if you find out the day one, corroborating your symptoms to the presence or absence of the viral infection, things become really easy. So I have categorized the symptoms based on the severity and on the diagnostic significance. So there are different colors, as you can see. So the red color, there's only one symptom, loss of smell or taste. So this is a very important symptom. If you experience this symptom, more or less you have COVID infection and you must get yourself tested, because it's a very important and a fairly specific symptom, right? These symptoms in yellow, that is fever, cough, throat irritation, breathlessness, or loose motions. These are also quite specific if you have 3 or more of those symptoms, right? So if you have fever, cough, throat irritation, then probably you should get tested, and we'll have we'll check if you're testing positive or not. Also, having said that, even if you are negative, we know that there is something called false negative, which means that even if you are negative, you may have a COVID illness. And in medicine, we always value symptoms over lab reports. So yes, symptoms are the most important factors, and you must have a look on these. You can just refer this slide. So as I told you about the yellow ones, if you have 3 or more, you should get yourself tested. Then the blue ones, if you have headache, body ache, cystitis. Cystitis essentially means if you are having pain while urination, or if you're having pain below the stomach. We call it suprapubic, but for everyone to understand, you can say below the belly, probably. And if you have nausea, vomiting, or if you have anorexia is loss of appetite. And if you have extreme fatigue I have not mentioned. So if you have 4 or more of these, or 2 of the yellow ones and 2 of the blue ones, then you should get yourself tested. If you're confused regarding if you're having 2 of the yellow ones or 3 of the blue ones, then you can always get in touch with me or any other treating physician, and then you can get your doubts clarified. That's not a problem. So these were the symptoms which you need to have a look, so that you understand when to get yourself tested, and then we'll talk about what tests which need to be done, and what course of actions you have to follow after.
Right. Very interesting, Doc. The red color that you showed us was the one single symptom which would indicate COVID, if I've understood correctly.
Yes.
Your color schemes out there made it a lot more simpler for us to understand. Doctor, as we go forward, there's a lot of confusion in the minds of viewers as well as patients today about the various kinds of tests that are prescribed for COVID. You have something called the PCR test, you have the rapid antigen test. Now, what exactly are we as patients expected to do? Are we expected to go ahead and take a PCR test, or are we expected to do a rapid antigen test, or are we expected to do both? And in fact, let me have a corollary to that question as well. We also often hear of people going in for a CT scan, or probably they're often prescribed a blood CRP level check. Now, is it necessary for us to actually do a CT scan on day one itself when we suspect that we have COVID? If you could throw some light on these various tests, that's going to help all our viewers, I'm sure.
Right, right. Very important question. As I told you, recognizing day one is extremely important at the right time, because if you ascribe your symptoms to COVID later, then probably you would test later, and then you would think that that is the day one, whereas actually it is day 4 or day 5, and then it becomes very difficult for us to understand when to start the right kind of treatment. Okay, so once you know that these are the symptoms and these could be ascribed to COVID, then you are in a confusion as to which test should I go for. So there are two kinds of tests of diagnostic value. One is rapid antigen, what we call as RAT, rapid antigen test, and the other one is RT-PCR, right? So the differences between the tests are that rapid antigen test gives you a report in 15 to 20 minutes, but it's less efficient than RT-PCR, which means that if 100 COVID positive or 100 patients who have COVID get themselves tested on a rapid antigen test, only 50 people will show a positive result, right? That is the efficiency of the test, 50% almost. And for RT-PCR, it is 80%, which means that if 80 COVID patients get themselves tested on RT-PCR, then 80 will get a positive result. Yet
Right.
there will be 20 people who will have COVID, yet the result will be negative. So that is what we call as false positive. So we must not, that's what I said, that symptoms are more important than reports. So if you are having full-blown COVID symptoms, and yet if your report is showing a RT-PCR or a rapid antigen test negative, then you should either repeat your test or you should start your treatment, because RT-PCR takes 2 to 3 days to report. And now with the humongous case load which we have, initially I would advise everyone to get a rapid antigen test done, because the report comes fast. If it's positive, then you don't have to do any other test, because there is no false positive as such, but there is a false negative. And if you get a negative result on rapid antigen, then yes, go for RT-PCR. And if you're having proper symptoms, then yes, we'll start your treatment then and there, even if you have a negative result, right? Because it's very important for you to understand that if the treatment is not even the symptomatic treatment, if we know when is the day 6, right, then we can start the appropriate treatment at the right time. Okay. And as you spoke about CRP and CT scan, yes, those tests do indicate the amount of inflammation going in your body, but to catch it at the right time is extremely important. Otherwise, you would have a false sense of assurance, right? You would do it on day 2 or day 3, and you would feel, yes, there's nothing going on in my body and I'm completely safe. But the real thing starts on day 6 or day 7. So the use of CT scan or CRP is only after day 6, and not every person should get a CT scan done. Only if your oxygen levels are falling, or if you cannot tolerate physical activity, is when you should get a CT scan done. As far as CRP is concerned, I would advise symptomatic COVID patients to get a CRP level after day 6, because if it's high, then yes, we could take a right call of whether we can start steroids or not. But yes, CT scan only for patients who are requiring oxygen support, because in medicine we believe that a test should be done only if the treatment has only if there is any effect on the treatment, right? If you're doing a test and if in any way we are going to carry on the same treatment, then there's no use to test, because you're unnecessarily exposing the person to an unnecessary test, and you're also exposing a multitude of people to COVID which the patient has. So yeah, that was all about tests. And
interesting, doctor. Let me just intervene out here. Effectively, it would be very difficult for us as patients to understand which was day 1, which was day 2, day 3, and so on and so forth.
Yeah.
And you mentioned that the CT scan should ideally be done at the 6th day level. difficult for us to understand which is our 6th day, because we don't understand which is day 1. Therefore, are you indirectly suggesting to us that we do a CT scan and a blood CRP only when the doctor prescribes it, rather than proactively doing it ourselves? Is my understanding correct?
Yes, very correct. Because in short, let me tell you that the day 1 is the day when you are getting your first symptoms, right?
Right.
Many individuals believe that the day 1 is when they get their positive report, but that's not right, because the report comes 2 to 3 days after you have tested. So even 3 days before you had COVID, right? So it's very important to know which day of illness you are on, and so that even you can communicate this to your doctor, and the communication becomes really easy and treatment becomes fairly simple.
Beautiful, doctor. During the process of isolation, when we are actually at the point of quarantine, we are often very anxious as individuals. Obviously, you're suspected to have COVID, and therefore all of this anxiety results into us doing several rounds of checking of our oxygen level, of our temperature, and so on and so forth. In fact, the anxiety levels are so very high that sometimes some of us are literally tempted to do it every 5 minutes. I'm talking about the oxygen level test as well as the temperature test. Now, can you guide us on what really is the right number of times that one needs to check your oxygen levels when you're at the process of quarantine or isolation? That's one. And then, having understood the oxygen levels and the temperature levels, which are the parameters that one needs to share with your treating doctor, and how often do we need to do this? If you could shed some light on this, Doc.
Right. So there is a monitoring protocol which you can follow. It's very simple. It's very important, firstly, to monitor your disease. Patients generally undermine the importance of monitoring, but in a disease like COVID, even more than treatment, monitoring is important, because it helps you and the doctor to understand what is the next step which is to be followed. Right. So yeah, I have many patients have come to me and have told that they are very anxious about their oxygen levels and how many times they should check. So it's very simple. You can just check your oxygen levels and monitor your vitals whenever you have food. That is, whenever you're having your breakfast, lunch, and dinner. So thrice a day. One never forgets to have food. So you can just link that time with monitoring. So three or four things which you should be monitoring. The first is temperature. Use a thermometer, keep it in your armpit, or as we call as axilla, and measure your temperature. More importantly, don't share it with anyone unless the person with whom you're sharing is also COVID positive. Second, your pulse and your SpO2. As we discussed, SpO2 is saturation percentage of oxygen. So just put your oximeter on your index finger or ring finger. Make sure that you are resting for the last 5 minutes before you put on your oximeter. Keep it on your chest level and record your readings. Okay. Wait for 30 seconds, and whenever the readings are stable, that is when you record them. There will be a symbol stating PR. So PR is pulse rate and SpO2 is oxygen. So you have measured temperature, pulse, and oxygen. If it's possible, it's also advisable to measure your respiratory rate. It's very easy to measure respiratory rate. Just lie down and count the number of times your chest is going up and down. So that's one breath. All of us know how to calculate the number of breaths. So basically that is the respiratory rate. It should not exceed 20 or 24. We'll come to that, what is the normal range and all those things. But yes, day 1, you recognize your symptoms, you consult your doctor, you start monitoring, you get yourself tested. These things are very important. And every day you should report your vitals, which is your monitoring chart, with your doctor, right? I'll just show you a very good patient who actually used to share with me all his updates in a very systematic manner. Can you see my screen, Sanju?
Yes, it can be seen, Dr. Akshay.
Yeah. So, yes. So when he came to me for the first time, this is how he shared all his information in a very succinct manner. So this helps both the patient and the doctor. We don't miss out things when we ask for the, do you have diabetes? Then he says no. Then do you have sugar or or BP? Then he says no. Things get lost in conversation. But if any patient, tells everything in one message, it becomes really easy. So your name, your age, gender, when did you test positive, when did the symptoms start, what happened on each day, were you taking any other medication like for diabetes or PP or thyroid, and how would you describe your symptoms? Also, every day when I was in touch with him, he used to send me a list of all his parameters. So he's written the temperature in the fever under the fever heading. Then he's written SpO2. So you don't have to type this out. Probably he typed it out once and then he copy pasted this. But you can just maintain a notebook, make columns, SpO2, temperature, pulse, respiratory rate. And yes, there's something called 6-minute walk test. I missed that. I'll talk about it. And every day, if you're experiencing any new symptom, you can talk about it. So this makes it very easy for us to communicate. I can just finish, advising him in 1 or 2 messages. I don't have to keep a trail of messages and always, skim through the conversation to know what he was suffering from. And as you know, there are so many COVID cases and doctors are heavily overburdened with work. So it becomes very easy to follow up with such patients. Coming back to the 6-minute walk test, it's a very important parameter to assess the progress of disease, right? So what is 6-minute walk test? I told you that whenever you measure your oximeter, your SpO2 readings, you're supposed to be at rest for 5 minutes before you start measuring. So what you do is you measure your SpO2 levels, then at a comfortable pace. Okay, I'm saying comfortable pace because old people might have a lesser pace than young ones. So at a comfortable pace, walk for 6 minutes in your room, wherever you're isolated. And then after 6 minutes, measure your SpO2 levels, right? So what the difference between the after walk and before walk levels should not be more than 5. For example, if my SpO2 levels before walk was around 98 and after was 90, then I think I have to worry because the difference is 8, which is 5 or more. So this is another parameter which you should be, recording. So let me go back and revise everything. Symptoms, you saw the chart. You now are able to ascribe it to COVID. The first thing you do is, even before testing or getting in touch with the doctor, is isolation, right? Isolate or get yourself tested, get a consult with a doctor, then monitor. Monitor, what will you monitor? T, temperature, P, pulse, R, respiratory rate, TPR, S, SpO2, and 6-minute walk test. How many times will you do it? Thrice a day, along with meals, breakfast, lunch, and dinner, so that you don't forget, right? So this was all about monitoring, and I showed you the consultation slide, an effective way to communicate with your doctor. And there's another slide actually which I'd like to show. So can you see it?
Yes, that's visible now.
Yeah, this is a very important slide which I wanted to show. During the course of your illness, you must understand that time is a game changer. I'm repeating this and I'll keep repeating this because this is a very important statement. In COVID, if you don't do things right, things can go really downhill. And after day 6, there needs to be meticulous monitoring. I've mentioned the do's and don'ts. So don'ts, don't wait for a positive RT-PCR report. As I said, RT-PCR takes 2 or 3 days now. If there is a very high workload on the labs, then it might even take more. So if you do a rapid antigen and it shows a negative result, but you have symptoms, then don't wait for a positive RT-PCR report. Get a consult with a doctor, isolate yourself, monitor, and we'll start giving you symptomatic medications. And by day 6, we'll get a CRP test done and see if there is any inflammatory process going on in your body, if there is persistent fever or any other process going on. Then don't do a doctor and drug hopping. This is a very a frustrating thing for doctors because if you go from one doctor to another, Yes, there might be one or two things which will be different, but essentially there's not a lot of difference because the information floating around in the medical community is the same. We follow standard guidelines. There's nothing which doctors independently come up with. We follow the ICMR guidelines, the WHO guidelines, the CDC guidelines. So and don't hop from one doctor to another, because then it becomes difficult for every doctor to follow. Because if you're starting with a particular doctor, keep following up with the same one. Don't fall prey to pseudoscience. There are many, WhatsApp forwards and information floating around in the social media, which may be ineffective, or even it may be worse. It may worsen your condition if you don't follow the correct medical advice. What are the do's? Meticulous monitoring. As I said, monitoring is more important than treatment sometimes, because uh, starting steroids at the wrong time, you all must be knowing about black fungus, or what we call as nuker. So if you don't monitor your symptoms, if you don't monitor your vitals, and if you start steroids at the wrong time, it can lead to hazardous consequences. Succinct consultations. I showed you the exact way of how to talk to doctors so that you can get the best outcomes possible. Then regular vital updates. Essentially, that's what is meticulous monitoring. You should regularly check your vitals with breakfast, lunch, and dinner, and inform the doctor on a daily basis in one succinct message. So these are the common things which you should follow, so that it becomes easier for you and your doctor to give treatment, and for you to have the best outcomes possible. So yeah,
Well,
this is all about monitoring.
right. Well, doctor, there is, we understand, at least that's what we're given to understand. There is no cure today for COVID. If there is no cure for COVID today, then what is the rationale behind any treatment at all if there is no drug available? Can you shed some light on this, please?
Yes. So yeah, there is no particular drug which can be claimed as anti-COVID, which kills the virus. Yes, there is something called as 2-DG, 2-deoxyglucose, which is developed by the DRDO, and this drug has shown some promising results, but there's still a lot of data which needs to be collected, and then we can talk about the efficacy of the drug. But as far as any other drug is concerned, there is none which can act against the virus, which is why steroids forms the basis of all the treatment, since we can reduce the inflammation and thereby prevent fall in oxygen in our body. But yes, we use steroids, and the reason for it is that the COVID illness is divided in 3 phases. So why am I stressing on day 6? And because after day 6 is what is called as the pulmonary phase. So that begins after day 6, usually around day 6, day 5, day 6, day 7. So what happens in pulmonary phase? In pulmonary phase, the WBCs start attacking the virus, and the byproduct, which is the inflammatory process, causes damage to the respiratory membrane, which causes the exchange of, which is responsible, rather I would say, for the exchange of oxygen. And as I mentioned before, if this membrane is damaged, there is no exchange of oxygen, right? So our goal is to limit this damage to the respiratory membrane. So we use steroids. So steroids form the basis of this treatment. I'd like to share a very informative slide. So yeah. So this is how we divide the illness. So -1 to +5 is 1 day before you get your first symptom to 5 days after you start after your first symptom. So that is the phase of early infection. So steroids are harmful in that phase because, as I told you, steroids reduce our immunity, because our immunity is responsible for the inflammatory process, right? So if you give steroids in the first 5 days, the virus's action can in fact increase and cause more harm than not using steroids in the first 5 days. So it's very important for us to know when exactly is the first day. Then is from day 6 to day 10 is the pulmonary phase, and it is in this phase that we should use steroids. And after 10 days is something called as a hyperinflammatory phase, where we use a term called cytokine storm. If you've heard it, I don't know. But cytokine storm is a place where none of us want to be, because it is in this phase where everyone becomes heavily dependent on oxygen, and ventilators and ICU support is required. And most patients don't come back if they, go in that phase. And this is another slide which I'd like to share with everyone. This is an indicator of the factors which can be used to assess if a person is in pulmonary phase or not, right? As I've written on the top, that pulmonary phase, the best bet. It's the best bet for us to start steroids. Yet I would, warn everyone not to use steroids on your own. I've seen many patients on day 2 or day 3 of the illness coming with prescriptions of steroids. Now, I don't know, I don't want to talk ill about anyone in the medical community, but yes, there may be a few doctors who are not well aware, or there are patients who are starting, steroids on their own, or they're consulting a chemist and the chemist gives them steroids, but that is not the right way to go. It can cause, it can lead to fatal consequences, right? So if your fever is more than 7 days, if your respiratory rate is more than 24, if your NLR, so what is NLR? When you get a CBC done, a complete blood count done, there is something called as a neutrophil and there's something called as a lymphocyte. So N and L. So if you divide, if you put neutrophil on the numerator and lymphocyte on the denominator, then there's something called as a neutrophil lymphocyte ratio. If that ratio is more than 3.5, then probably you're in a pulmonary phase. Then there's something called CRP, which we discussed, the C-reactive peptide, an indicator of inflammation. If that is more than 25, you're probably in pulmonary phase. And if CT scan more than 12 out of 25, if your SpO2 is less than 94, and if your 6-minute walk test is positive. Now, why did I ask you to do your SpO2 and 6-minute walk test and respiratory rate on a daily basis, even fever for that matter on a daily basis? Because some patients do get their pulmonary phase before day 6. So if your SpO2 is less than 94, if respiratory rate is more than 24, if 6-minute walk test is positive, then we might detect your pulmonary phase, if in case before day 6 at that time, and we can probably take the right call of when to start steroids, and that could be life-saving. So you don't have to get CRP levels before day 6, but if you're having such symptoms and if you're having such vitals, then yes, you should get a CRP done. And then if you're requiring oxygen support, then yes, definitely you should get a CT scan done. And yes, this is another slide which I wanted to show. This particular patient from Gurgaon in Delhi came to me, and he was in his day 6. He was having oxygen on borderline levels, 93, 94. I asked him to get a CRP level done. It was 220. You see on 27th April, I think, yeah, 220.14. And the normal level is 0 to 5. So 220
Wow.
is another level. But what we did is we assessed his condition and we started him on the right dose of steroids. So everyone, please note that there is no particular, blanket dose for steroids. That not everyone can be started on the same dose of steroids. It is dependent on your weight and many other conditions, whether you have diabetes, blood pressure, if you have any kidney problems. So we need to get some basic tests done and then we start your steroids. In this day and age, when there are so many black fungus or mucor cases, we need to even measure your blood sugar levels. And if they're not in line, probably we'll start you at a lesser dose of steroids, because we'll have to properly weigh the pros and cons of starting steroids, which a chemist or which a quack doctor or for that matter, even you can't assess. So it's very important to be in touch with a good treating physician. So what we did is on 27th April, we started him on the right dose of steroids for the right dosage interval. And as you can see on 1st May, his CRP level was 27. His oxygen came back to around 96, 97. And the patient didn't require, we still arranged oxygen support for him, but he didn't require oxygen support for more than 2 or 3 days. So, and then he came back even in home isolation itself did not require admission. I'm not saying that one must not get admitted, but at that point, there were no beds available and we had to treat him at home itself. So yeah, this is the whole the mechanism why we should use steroids and why we should use, how we should use, and how long we should use. So I hope you understand the seriousness of the situation and you don't start using steroids irresponsibly because it's a very risky drug to be used, but it's
Sure.
really life-saving.
Sure. Doctor, there are a lot of stories going on these days about black fungus, and we hear different versions of these stories on black fungus. Now, we also understand that black fungus is caused due to the use of steroids. And if this is what you say, then is it necessary to have a steroid at all, even if one has a COVID pneumonia? How does one make this decision at all? Black fungus on one side, the use of steroids causing the black fungus. Can you help throw some light on this, please?
I understand your plight, but as I explained the intricate mechanism of how steroids work and why steroids are required, we must understand that if there are so many cases of COVID recovery, which is almost around 85 to now 90%, if you see the statistics, the moderate COVID pneumonia, which requires hospital admission or oxygen support, are all started on steroids mostly, and the treatment is successful because of those medications. Yes, there have been cases of mucor, or as we call black fungus. In medical terminology, we call it mucormycosis. Yes, it is associated with steroid use, but that is associated with irrational steroid use. If you're using steroids at a high dose, if you're starting steroids very early in the course of illness, if you're using it for too long at a very high dose, then yes, you're at risk of mucor. Because mucor, like any other infection, but more than others because it thrives on blood sugar levels. So what happens in COVID is your blood sugar levels increase. It's a diabetogenic disease, which means that a person having COVID has a higher risk of high blood glucose. And on the top of that, if the person is previously diabetic, then the story becomes very murky. And on the top of that, steroids themselves are diabetogenic drugs. Steroids themselves cause increase in sugar. So it's very important to be in touch with a treating physician who understands, and most of us understand what the mechanism of drugs is. And it's very important to get a baseline blood sugar level before you start steroids. You should know if the patient has diabetes from before, if it's controlled. If it's not controlled, start the anti-diabetic drugs so that the sugar is in control, and then start steroids. And that also starts steroids for the cases who are in pulmonary phase, right? And you should not start steroids if your oxygen levels are not falling. There's no use of using steroids if your oxygen levels are intact. Many studies have proved this statement. So yes, there are cases of mucormycosis, and we are studying the relation between COVID and mucor, because there are some cases where we haven't used steroids at all. They don't have diabetes, they never had diabetes, yet they're having mucor. So probably it's because COVID itself is causing mucor. But in science, we can't make blanket statements like these. And right now we are only controlling the blood sugar levels, the steroid, following steroid protocols. But yes, we'll soon find out why mucor is related to COVID. Probably it's because of the COVID virus itself. But from whatever we know right now, and we keep knowing every day more and more, we'll keep you up to speed.
Right. Dr. Black fungus and steroid is something that you have now confirmed to us. I know of a lot of my friends or people in the general public who often come to us and say, it's better I don't take the risk, and straight away on their own rush and take on some steroids. So I'm so very glad that you're actually clarifying all of this for us. There's a lot of misinformation even otherwise, Dr. Akshay, that's floating around in the market. Can you bust some of these myths for us, the general myths that we have, so that all of us are a little more careful about what we do and how we conduct ourselves?
Right, right. So yeah, I'd love to bust some myths actually, because I've been facing a lot of these in my practice
Sure.
every day. Yeah, so the most important is steroids cause mucor. No, steroids don't cause mucor. Using steroids irrationally, irresponsibly may cause mucor. Having said that, there are diseases which require routine steroid use, like rheumatoid arthritis, asthma, lupus, conditions which require patients to use steroids on a daily basis. And the funny thing is, none of them have developed mucor over so many years. So why is it? It's because people are consulting chemists, people are using steroids on their own, or probably because there is something with COVID which is causing mucor, mycosis. So you should, as I discussed with you before, use them rationally and always use them in consultation with a treating physician. Secondly, is that steam kills COVID virus? No, not at all. Steam might help you with symptomatic treatment, symptomatic relief. If you're having nasal blockage or nasal congestion, yes, you should use steam twice a day. But steam does not kill steam does not kill coronavirus. If that would have been the case, then we wouldn't have such a huge pandemic. Steam is readily available, and it's an unscientific statement to make. Yes, having said that, you should use steam inhalation only if you're having nasal congestion and nasal blockage, because we have seen patients who've got internal burns because they're using such heavy bouts of steam inhalation. So please refrain from doing such things. The other myth is that many patients, since we cater to uh, generally the lower socioeconomic strata, I don't know if there's a lesser awareness only amongst them or the whole community of patients. But many patients come to me and say that COVID does not exist; it's just a conspiracy theory made, and nothing of this kind we have ever seen before. But this is also an unscientific statement to make, because such things have happened before. And if COVID would have been a conspiracy by the pharma and the healthcare community, we wouldn't have had 1,200 medical professionals. They've lost their lives over the 1.5 years of pandemic in our country alone.
Absolutely.
And on duty, right? Doctors on duty, not doctors, who are off duty and have incidentally got the disease. They have got the disease while serving patients, while treating patients. And yes, there have been pandemics before. There has been AIDS in the 80s when no one knew about AIDS, and suddenly in 81 it developed in Africa. In 85 it came to India, and now still today AIDS continues to be a disease for which we don't have a curative treatment. We can only prolong the life of the patient by giving treatment. But yeah, that's a disease which is, yes, although it's less contagious because the mode of spread is different, but yeah, there have been pandemics, even smallpox, even polio for that matter. Another symptom which I'd like to bust is that the vaccine itself causes COVID, and it has serious effects and you should not take the vaccine. Absolutely false. Vaccines are very important in controlling the spread of illness and also reducing hospitalizations and deaths, because after vaccination there is 99% reduction in patients who require oxygen support and ICU support. So yes, even after vaccinations you can have a COVID positive illness, but you won't be as symptomatic as you would have been if you wouldn't have the vaccine, and you wouldn't require oxygen or ICU support. Like 99% people wouldn't require. And there have been so many stories which can be linked to vaccine success, like polio. When in 70s and 80s we used to have so many patients with polio, but with the oral polio vaccine today, there is no child who has polio. Even smallpox, these two diseases are eradicated. There's no one in the world who has smallpox, and there are only 3 countries out of 197 countries in the world which have polio, right? So India doesn't. India isn't one of them. It's Nigeria, Pakistan, and one of the African countries. I don't remember, but yeah. Another myth I'd like to bust is that the constant changing guidelines mean that we know nothing about the disease, which is actually it's actually the opposite way around. The thing is that we are knowing more and more about the disease every day. Every day results of experimental trials. Trials mean experiments. They're coming out. We are knowing what is going on in the community, because every time a COVID patient is admitted in the hospital, we had to send data to the government institutions, and when we link such data to different things, different aspects of the patient, we understand more about the disease. And that's why we revise guidelines, so that control of we can control the spread of the disease, and we can give better treatment. So yes, there is a scientific basis for why we are changing guidelines. Yeah, these are some of the myths I'd like to bust. And
Dr. Akshay, you spoke. Sure, sure. You spoke a lot about the vaccines. In fact, there is a lot of confusion today on vaccines alone. There are different brands that exist today. You've got the Covishield, you've got Covaxin, you've got new brands coming in from Pfizer's, you've got Moderna coming inside. And there's a lot of confusion amongst the general public in terms of which is the best vaccine. I had some of my friends also who asked me, to say, no, I don't want to take a Covaxin, I want to take a Covishield because I believe Covishield is better than Covaxin. So is there something called the best vaccine? One question. A couple of other ones. In terms of the vaccine itself, what is the prescribed gap between two doses of a vaccine? And more importantly, what is the right time to take these vaccines, particularly if one is already infected with COVID? Is there some kind of a time frame that he needs to keep away? And probably a last question to the COVID world, to the vaccine world itself, is that are there any adverse effects when it comes to taking the vaccine at all? So some of these bits, if you could help throw some light, Doctor.
So let's go step by step. The first is there a best vaccine, if any? No, there's no best vaccine. All vaccines which are being approved by the DGCI, Drug Controller General of India, WHO, CDC, have a threshold level of efficacy, only after which they're approved to be used in the in the markets. So the vaccine which you should be taking is the one which is readily available and for which you have an access to. So Covaxin and Covishield are you can use any of them, but the thing is that the dosage interval is different. The Covaxin the second dose needs to be given after 28 days, after a month. Whereas for Covishield, yes, there have been many changes in the dosage intervals. So right now we follow 84 days or 12 weeks. The reason for this is because data from the UK, United Kingdom or Britain has shown that if we use, let me quote the data from the journal Lancet. Lancet is the most prestigious and the most reliable medical journal in the world. So that is stated, let me read, is that 51.1% is the efficacy if you use it less than 6 weeks. And if you use it 12 weeks apart, which is the current guideline, the efficacy becomes 81%.
Wow.
Right? So it's better to be used after a gap of 3 months. This is a data-driven decision. This can, some people may question this, that yeah, we are increasing the duration interval because there is a shortage of vaccine. That is partly true. We must understand that, but yet it's a right decision. Yet it's a right decision because we must understand that vaccine is a collective idea. It's not an individualistic approach. You might think that you want both the doses of vaccine, but what we have observed is that even after one dose of vaccine, I'm again quoting a British medical journal, BMJ, again a very prestigious journal. It says that 76% of the individuals after a single dose are are protected against the symptomatic COVID in 3 months, which is 12 weeks after the first dose, which is why we advise the second dose to be taken after 3 months or 12 weeks. So if everyone has the first dose, 76% are prevented against symptomatic COVID. And as I've told you, even if you get a COVID, it won't be symptomatic. Even after the first dose, you won't require oxygen support. You won't require ICU support. except the people who have, heavy comorbidities like uncontrolled diabetes, BP. So my only advice to those people, who are not able to get their vaccines is that please control your comorbidities, keep your blood sugars in control, keep your blood pressures under control, go to your diabetologist or your whoever physician you're consulting for your disease, and make sure those parameters are in control, and believe in the data-driven science which we follow. And if you're apprehensive about the Indian situation, let me tell you that the UK has been following the 12-week dosage interval now much before us, and it is from their data that we have changed our protocols. Even even countries like Canada and Spain are using 16-week dosage intervals, and that's not even data driven. That's probably conjectures or lab tests, but that's not data driven. But our 12-week decision is quite data driven. Coming back to the question on adverse effects following immunization or vaccination, we call it AEFI. Yes, there have been reportings of cases with thrombosis, which I mentioned before as clots which form in the blood. Yes, there have been, but more in the UK, and we cannot compare most things, probably because the genetic makeup is different. But yes, there could be cases, very rare, but things you should look out for are chest pain, breathlessness, calf pain, and palpitations, right? If you're experiencing any one of these four symptoms, I repeat, chest pain, breathlessness, calf pain, and palpitations. Palpitations mean a feeling of many people tell me that yahan pe dhak 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 ho raha hai. They complain like that. So if you're facing any of those things, get in touch with your physician. We'll immediately start you on blood thinners and things will be better. Don't delay. Watch out for these symptoms. Having said that, there are a few symptoms. I'd like to show a slide. Can you see this?
Yes, Dr. Akshay, it's visible to us.
Yeah, so have a look at this slide. So these are the symptoms which are very common and you don't have to worry about them. Like pain at the site of injection, fatigue, chills or feeling feverish, nausea, headache, joint pain. These are all symptoms which don't have any, serious or fatal consequences. These are normal. These will subside with a paracetamol for 1 or 2 days and just some bed rest, right? I want to show another slide. Yeah, we missed this. Home-based treatment, something which you can take it on your own, is when you recognize your day one of illness, when you start monitoring isolation, give your test, and wait for your reports, you can start treating your fever, cough, throat irritation, body ache, and loose motions yourself, right? There is a list of medications which you can buy over the counter from the chemist. I'll be sharing it with Sanju. He can forward it to you. I'm aware that you all have a WhatsApp group, so you can share it with over there. Fever, you can take paracetamol, or if it's not resolving with paracetamol, you can take naproxen 250 mg twice a day. For cough, you can take any cough syrup, Bro, ZX, Alex, or Grillintus. Throat irritation, you can do betadine gargles. They're very effective. Please don't use, again, a very important warning, don't use azithromycin or doxycycline or ivermectin. Ivermectin, yet we have questionable results, but doxycycline and azithromycin, we don't have solid data to prove that they're effective because they're antibiotics. This is a viral disease. You cannot use antibiotics which are used to combat bacteria to treat a virus. It's like using a mosquito repellent to kill a cockroach, right? It's very ineffective. For body ache and loose motions, again, for body ache, you can use paracetamol. If you have headache, you can use Meftal. I'll be sharing a list of medications. Loose motions, you can use ORS to hydrate yourself, rehydrate yourself, and you can use loperamide against loose motions. Supplements, vitamin B, C, D, and zinc. Yes, many people use it, but I don't understand how using vitamins for 2 or 3 days can bring your levels to normal. I would rather advise you to be on a healthy, nutritious diet and yeah, if you have detected deficiency of vitamins before, you should be on those vitamins from like on a normal basis, not after you get COVID, because levels don't normalize in 2 or 3 days or even in 4 or 5 days. It takes time. What is ivermectin, doxycycline, and budesonide? Yeah, budesonide is an inhaler, like a pump, which asthmatics use. It should be used if fever is not resolving after 5 days at a dose which I'll be sharing with you all. Please remind me, Sanju, later. I'll be sharing a list. And the pulmonary phase, yes, steroids and anticoagulants, as discussed before, you should not be using on your own, and it's not a part of home-based treatment. I just mentioned it on the slide, but you should be in touch with a treating physician, and he should prescribe steroids and anticoagulants for you. So yeah, that is the whole crux of treatment, vaccines, myths, monitoring guidelines, and everything.
Well, thank you very much, Dr. Akshay, for that very, very informative session, I must say. We will now straight away dive into questions that have come from our audience, from our viewers. I'd just like to remind our viewers, if any of you have any questions, you can post them on to the Catholic Gym YouTube channel chat box, and our control room will in turn send all of these questions to me. But before that, I have a very, very special announcement to make. And here it goes. The next virtual session will be held on the topic specialized care of senior citizens. This session will be held live on Sunday, the 20th of June, 2021 at 11 a.m. sharp, Indian Standard Time, only on the Catholic Gymkhana YouTube channel. The speaker for the session will be Dr. Naganath Prem. For those of you who may not know Dr. Prem, Dr. Prem is a consultant geriatric medicine elder care specialist at the Jaslok Hospital in Mumbai. I can tell you, ladies and gentlemen, it promises to be a great session since it will enlighten us. It will tell us how we could help elders understand what they can do for a graceful living. And at the same time, it would help the youngsters or the younger generation to understand what they can do for their elders. So ladies and gentlemen, be there on Sunday, the 20th of June, 2021 at 11 a.m. sharp. We will now dive into the questions that have come from our viewers, and my control room has sent me the questions here. Control room manned by Aubrey and Ian are working overtime. The control room, how many have you sent me? Oh, wow. We have 12 questions already received, Doctor. I think you're going to be here not just for lunch, but you're going to be here up to probably dinner time today. Nevertheless,
no, I'd love to.
Sure. I'm sure you're ever willing. Sure, you're ever willing, Dr. Akshay. But I must forewarn you, some of these questions were received by us during your session itself. And there is a very good likelihood that you may have addressed some of these. I will nevertheless read all of these questions. And if you have answered them, you can probably try and shorten those answers so that we concentrate on the other many questions that are here before us. All right. Here goes it. What does it say? 12 questions. Let's get ready. The very first question, it says, the duration of protection with Covishield has not yet been established. Is there a need for a booster? When and at what interval of time?
Okay. So yes, this is a very questionable area because there hasn't been enough data on which we can comment that what is the exact length of the immunity provided by both the doses of the vaccine. But that will only be possible when people who have received both the doses of vaccine come with COVID. Are you understanding?
Sure.
If someone has both the doses of COVID and yet gets COVID and comes to us probably after 6 or 7 months, and if a sizable number of such patients come to us, that is when we can say that yes, that after 6 months or after 7 months, patients are coming with even after receiving the vaccine, and hence we should give a booster dose after these many months. So right now, I'm not in the position to answer this question. I should be honest. I should not be giving any false information and, leave you with a false sense of assurance. So right now, the best thing is to take both the doses. And yes, there is a considerable level of immunity up to 6 months. But after that is time has to decide the answer to this question. And yes, if there is any data which, suggests the use of a booster dose and when we should use it, I'll be updating you all. There are many websites which provide correct information, one of them being CME India. If you understand medical terminologies well, you can go and keep checking that website. It gives correct and medically sound information. So please don't believe WhatsApp forwards. You don't even know who writes them. So how can you, believe if I'm telling something and if I'm wrong, you can at least catch hold of me tomorrow and tell that what were you saying, and but who will you catch hold of if so please don't believe such WhatsApp forwards. And if you have any doubt, you can get in touch with me, or if there's something which even I don't know, I'll look up the data and let you all know. But for this question, yes, we have to wait till we have enough data for all of us to comment on it.
Sure. We move on to question number 2, Dr. Akshay. It says, if Covishield, Covaxin, Sputnik is given as the first dose, can Moderna or Pfizer's be given as the second dose or vice versa to complete the schedule?
No. So you cannot mix two types of vaccines. The only reason for that is because no one has tested. No one has taken one dose of Covaxin, second dose of Covishield, and then tested, if that patient has developed COVID after a few months or not. For the primary reason that all tests have been done with the same doses of the vaccine. So we cannot make blanket statements like you can use, because we only provide information which has been tried and tested. So yeah, you should not be using you cannot mix and match two different vaccines. That's not how it works, because we haven't known anyone who has done that way.
Right. Question number 3, Dr. Akshay, and this is what it says. Can the gap between 2 doses of Covishield be arbitrarily changed without any specific data? Can the gap between 2 doses of Covishield be arbitrarily changed without any specific data?
Okay, so I understand that most of us don't have a lot of trust in the government authorities, at least of India, and are bound to question the treatment protocols. But we must understand that these changes are advised and prescribed by the COVID working group, which consists of eminent immunologists, virologists, and public health experts. And as I told you, this change has been implemented after seeing the data from the UK. And it's a very, common thing to experience, that most of us believe in the foreign, treatment guidelines. So probably this will make you trust the system even more. And as I told you, even Canada and Spain has 16 weeks.
Sure.
So yes, it's data driven. It's absolutely data driven. And then also taken in consideration with the shortage of vaccine, not only in India, but all over the world. And as I told you, vaccination is a collective idea and not an individualistic idea, because this is a highly contagious disease. The whole community has to develop an immunity, and not only you. And that is when the whole pandemic will stop. So yes, please stick to the 12-week dosage interval. And you can't even take it before, because every time you go for the second dose, the authorities will check your first dose date, and there's no way in which you can get the second dose before 12 weeks. So just have trust on the system and the doctors, immunologists, and microbiologists.
So quite clearly, Dr. Akshay, from what you say, these changes that have been announced from time to time are not arbitrarily decided, but they're really decided based on specific data to answer the question that came in from the audience. Well, we get on to the next question, the 4th question coming from our... Sure, Dr. Akshay, go on.
So there is Dr. Gagandeep Kang. She is an eminent virologist from CMC Vellore. Regarding vaccines, you can just Google Dr. Gagandeep Kang on Google and see what statements she's making, and you can absolutely trust all the statements she makes, and they're very informative. That's what I do, so you can do it.
Yes, in fact, I did hear her some time ago, and it was some time ago before they had officially announced that doctor had come forward on TV and actually said that it is going to be a much longer, the gap, the duration is going to be much longer. And I would take my second dose a little later compared to what was announced at that point in time, based on, of course, data that was coming up. So thank you for that clarification, Dr. Akshay. We move on to our fourth question that's coming from our audience. This is an interesting one. It says, how hard or difficult would double masking be for breathing and for the lungs? Instead of double masking, can one use a shield with a single mask? Well, it looks like a lot of people are indeed suffocated using the two masks, doctor. If you could shed some light on this, please.
Yeah. So usually we ask patients to use double masks if they're using a surgical mask and a cloth mask. If you're using an N95 mask, you can only wear one mask. But yeah, even one surgical mask gives enough protection if you're using with a shield. Yes, but if you're only just using a surgical mask, I don't think it's that efficient. Yes, there is 70 to 75% protection, but considering the fatalities associated with COVID, you must use double masks if you're using a surgical and cloth mask. But if you're using an N95, nothing like it. You can just use one mask. It's useful for, I think, 40 hours. Yes, 40 hours. So what we do is that we work for 8 hours a day. So we use it for 5 days, 8 hours every day. And then we discard I keep it at my working place at my clinic. So, and then I come back with the surgical mask, the triple ply mask.
Right. Before I get on to the next question, just a message going across to our control room. If there are any more questions coming in from our viewers, please ensure that it is transmitted back again to my control room. We can have all of those answered together. We have received 12 questions so far. If there is anything else that's come thereafter, Aubrey, Ian, please transmit it across as agreed. We move on to question number 5 from our audience. And what does it say? Please share what should be the optimal SpO2 level and what is the safe limit?
Oh yeah, thank you for this question. Whoever has asked this question, I forgot to mention the most important thing. The optimal level is anything above 94. Usually it is 98, 99. But you can't expect an old person, a 70, 80-year-old person to have 98, 99. So we usually expect them to be around 95, 96. But anything less than 94, you should get your CRP levels tested. Probably you need oxygen support. And yeah, less than 94 is the level which you need to be worried about. And also a 6-minute test positive. Even if you're having 95 or 96, but after 6-minute walk test, it's coming down to 89 or 90, then again, you should, be worried and contact your physician ASAP. Another thing to mention is if you're having oxygen levels on the borderline, it's a very common doubt which we face. For example, if it's 93, 94, 95, then what you can do is ask the patient to, do awake proning. I don't know if you know about this. Awake proning is an extremely efficient way of increasing your SpO2 levels. There is no other way in which you can increase. First of all, if that's a question which comes, there is no other way which is proven to be used to increase your oxygen levels.
Could you explain how that is? Could you explain how that is done, Dr. Akshay?
Coming to it. Awake proning is done in, for 30 minutes, lie on your stomach. For 30 minutes, lie on your right side. For 30 minutes, sit with a 45-degree recline in this way. Then for another 30 minutes, lie on your left side. Okay. So over 2 hours, you do this exercise. And we advise this for patients who are on the borderline oxygen levels, or people even whose oxygen levels are less than 94 and are in the, process of arranging an oxygen cylinder or a process of getting hospital admission. So you can use that time to, maintain your oxygen levels or rather increase it. That's a very common thing which we advise. And why do we call it awake proning, and why not sleep proning, or why can't you just lie down on your stomach and sleep for the rest of the night? Because it's not good for your back. It can cause back pain. Things in medicine need to be done only for the prescribed time, like steroids, like awake proning. Because if you exceed or if you reduce that, you won't be doing that part of the job correctly. Or if you do more, it's not that you'll get more results. Things will worsen, right? That is why we have doctors. That is why we have, so much of science and so much of literature going around. So yes, please adhere to the statements and use them or follow them to the T, as we say.
Sure. We move on to question number 6, Dr. Akshay, and this is what it says. Is it advisable to give flu shots to kids before monsoon during this pandemic? Well, they're getting you into a spot now, Doc. This is going beyond COVID, but very interesting and useful questions. Is it advisable to give flu shots to kids?
Okay, so I haven't seen the data regarding flu shots and COVID, but I'll get back to you after, probably in the evening. I'll circulate a message, or whoever has asked this, I'll clarify this. I don't want to, sound intelligent by giving wrong information, but I'll have a look. If there is any data regarding this, I'll get back to you.
For the benefit of viewers, if there are any unanswered questions, and if when doctor passes on this information across to us, we will have our PR team who will probably put these questions together and circulate it on the WhatsApp group so that everybody benefits from these answers thereafter. Moving on to question number 7. After taking both the doses of the vaccination, if we still get COVID, how severe would it be?
So as I said, 99% of patients after having both the doses of COVID do not require heavy oxygen support or ventilatory support or ICU admission, which is why we advise everyone, we are spreading the message of vaccines all across, because the rate of hospitalization and deaths is what we're concerned about. Even if you test positive or have a mildly symptomatic COVID illness, it's okay, because you're fine and you don't have any major problems after that, and your life is saved. So yes, but yet there have been cases where there have been deaths and significant morbidities even after both doses of COVID, probably because those patients had severe comorbidities, were in their 80s or 70s, had cancer or kidney disease. These are the two conditions. Patients with kidney disease and cancer need to be extremely careful. Even after both doses of vaccine, they have to follow all the precautions rigorously, because they are at a higher risk of contracting the disease. Even patients on immunosuppressants, patients who are taking steroids for other diseases, their immunity is lower than other diseases because of the steroids themselves. So yeah, please maintain all, masking, sanitization. Please maintain all those precautions.
Sure. Before I get on to the next question, just a bit of clarification for all of our members. We are conscious of the fact that this program is streamed all across, not just Mumbai, but across the world. And we have some of our members, we've got some of our members guests as well across the world who log in to our YouTube channel to benefit from whatever happens. For the benefit of guests who are not members, the answers to some of the unanswered questions will be made available by our PR team, which is looked after by Yvette Malgi and Ian Pereira, on the WhatsApp group for the members. But for the guest, you can contact any of the member that you know. All right, I'm sure you would know some member of Catholic Gymkhana, and they in turn would access the information from the WhatsApp group that would get posted on by Yvette and Ian, and they in turn could pass this on to our guests anywhere across the world. Catholic Gymkhana will continue to be the conduit to pass on all of this information to benefit not just members of Catholic Gymkhana, but guests of Catholic Gymkhana as well. We value your patronage. We value you being with us. We move on to question number 8. A big concern over the third wave having an impact on children. That's what it says, Doctor. Will children be more vulnerable? And what plans are being envisioned, or what preparations are being made for children treatment? Would you be able to share something on this, Doc?
Yes. So children usually in the course of this illness, whatever children have been tested positive and admitted with us, or we've seen the children who are positive have shown a very good response naturally, because their immunity is quite developed and they can effectively combat the virus. And we've hardly seen any cases of deaths or significant morbidities in children. Having said that, it's very important for the parents of young children and infants to be vaccinated as soon as possible. That is a very important guideline which is being propagated everywhere. And probably there are even special, provisions made for children, parents of young children and infants to get vaccinated. So this is a very important question which is being asked, and I would advise and strongly advise parents of young children to get vaccinated as soon as possible, and maintain strict, levels of precautions when they are with children. If they're tested positive, and recognize day one, and isolate yourself as soon as possible. Yeah.
Sure.
But
Before I move on,
apart from any other age group or strata of age group, children have shown the maximum recovery rates.
Right.
From COVID.
Right. Well, before I move on to question number 9, I'd like to remind our control room for the very last time. We have 12 questions that have been received as yet. We are now moving on to the 9th question. If there are any more questions, may I request the control room to kindly transmit the same on to my control room up here, and we will have them read out for Doctor to answer. Before I get on to question number 9, yet another clarification. There's somebody who seems to be asking, please ask Doctor for the website again.
I'll just type it out on the chat. I'm on.
Dr. Akshay, as you can clearly see, we've got a set of viewers who are absolutely clued on to all that you're saying this morning. As you go ahead and project that up on screen, thank you so much, ladies and gentlemen, for these lovely questions. Very, very insightful questions. Dr. Akshay is at the moment.
Yeah, and someone has also
so here
asked,
he goes. Okay.
What about the vaccine for children below the age of 18? Okay, we'll go on with the questions we have collated.
But what about the website, Doctor?
I've typed it out on the live chat.
On the live chat. So for those of you who are on the Catholic Gymkhana YouTube channel, you will find the website available on the live chat. We will have it officially posted by the Catholic Gymkhana control team as well. The control team will take the website that's posted by Dr. Akshay and will post it under the Catholic Gymkhana chat as well. Okay, moving on to question number 9. A final reminder to our control room, if there are any, please rush them in right away. Question number 9. If a person has recovered from COVID-19, then what should be the gap for the vaccination of first dose be? If a person has recovered from COVID-19, when should he or she take the first dose thereafter?
After 3 months. So after 3 months of being naturally infected with COVID, you can take either the first dose, or if you've already taken the first dose, you can take the second dose.
All right. Thank you, Doctor. Moving on to question number 10 for Dr. Akshay. Give me a moment, please. All right. Can a lay person do an antibody test to check the percentage of antibodies, and at what period of time should they take the vaccine? Would you like me to repeat that, Doctor? Are we clear?
No, we're clear. I would not suggest anyone to get an antibody test done. for the simple fact that even after vaccination, firstly, the test is not that reliable. There have been cases where a particular lab, has given a contradictory result from another lab. So just take the vaccine, and if you're healthy and if you don't have comorbidities like uncontrolled diabetes or BP or on steroids, then you'll develop your immunity quite well. And as we said, the goal is to not reduce the number of positive cases. That is not the major goal. The goal is to reduce hospitalizations and deaths, right? So
Right.
the efficacy which is given when Covishield, for example, if they say Covishield is 60% efficient, Covaxin is 70% efficient, that efficiency is calculated regarding the positivity of the cases. But for both of them, 99% of patients don't face issues like hospitalization and deaths. Right. So the primary factor is that even if you're positive, yes, you will have a asymptomatic or a mildly symptomatic disease, but that's it.
Moving on to question number 11, and this is what it says, Doctor. How should we build immunity? How should we build our immunity system? And what vitamins should we take to build our immunity? What are the medications or medicines that should be taken if one suspects COVID on day 1 or 2? I think you did answer that. And there's a third
I
part to
told
this.
you.
Yes.
Please complete the question.
Yes. The third part of this question, it says, what precautions should we take at home itself?
Right. So at home itself, the most important precaution is keeping your house well ventilated. And whenever you're going out, make sure you don't go in an indoor setting as much as possible, because CDC, the Center for Disease Control in the USA, has given a very important statement that this disease has more to do with, it's more of an airborne disease than a contact disease. Like if the respiratory droplets fall on the surface and if you touch that surface, you're less likely to get COVID. But when I speak or if I sneeze or cough, the droplets remain suspended in the air. And if some other person inhales those, then he's bound to get COVID. So always make sure that you are in a well ventilated area where there's inflow and outflow of air. Try to be in outdoor settings, even if you're outside, wear masks. Sanitization is less important, only of your hands. There's no need to constantly sanitize surfaces. As I said, it's not an important factor. And as far as building immunity is concerned, do lung exercises. They're very important. There are 3 or 4 important lung exercises. One is belly breathing, push your belly out, take it in. Then another is pranayam, anulom vilom, what yoga experts suggest. That's actually important to help you recover. That's more important in recovery actually. Then there's something called as proning I told you about, and building immunity about vitamins. As I told you, it's very difficult to normalize your vitamin levels in 2 or 3 or 4 or 5 days once you get COVID. So what you can do is you can start having vitamin B and vitamin C normally, and don't worry about going overboard with the vitamins, because B and C are water soluble vitamins. So even if those get excess in your blood, they'll just come out via your urine. But vitamin D is a fat soluble vitamin. So you have to be careful about vitamin excess in vitamin D. So what you can do is, there are sachets of 60,000 IU, which is international unit, 60,000 IU. There are brands like Uprise, D3, or you can, I'll text the name of the vitamin D brand or the generic name. You can take that. You can take that once a week in milk for 6 weeks, and that should be it. Zinc, you can take 20 mg twice a day. But as far as vitamins and zinc is concerned, there hasn't been a proper study to confirm that these help in COVID. But in such a scenario, you're bound to take something which has no side effect. So I would advise people to take. Since these vitamins have no side effect, they'll just improve your vitamin levels. You can take these vitamins and always have a healthy and nutritious diet. That helps much more.
Sure. Moving on to question number 12, Dr. Akshay. It is mentioned that people with comorbidities could be susceptible to COVID. What are your recommendations for these patients?
Sorry?
What is your recommendation for patients who have a high level of comorbidities?
Right. So these patients are the ones who have, high rates of fatalities. So you must take extra care. You should not, which is why I advise that recognizing day one is extremely important. If someone in your family, for example, your grandparents are living in the same house and you develop COVID, and if you don't recognize it on day one, it's very important. It's very easy for you to spread it to them. So essentially, the prevention, precautionary measures remain the same, but just that you have to implement them more stringently, right? Also, you can ask them to have vitamins, even though there's no data to suggest, no proper data to suggest the efficacy. It's always good to be on a safer side since there's no side effect. And yeah, you should, if they develop, if the individuals with comorbidities develop a disease, follow the rules very strictly. Get in touch with the physician. Start steroids if necessary. I stress on if necessary because there are many comorbidities. Then you need to weigh the pros and cons of starting a steroid. And yes, decisions need to be made on case-to-case basis. You can't give a blanket statement because there are so many comorbidities and there are so many, levels of how high or how low your parameters are.
Well, we now have 3 more questions that have come in, Doctor. I'm sure you're going to be happy enough to take all of them. I'd like to inform our viewers that we will not be taking any more questions now. We will shut down the question answer time. Well, we've got 1 more as I speak out here. So totally 16 questions, 4 to go. I'll get on to question number 13. How should we build our immunity system and vitamins, and what vitamins should be taken? I think you've covered that,
Yes,
Doctor.
yes, yes.
What are the medicines to be taken if you suspect COVID on day 1 and 2? What precautions should be taken at home itself? I think you've covered that as well.
Yes.
And the other interesting one, which could be specific to a certain set of people, can a cancer patient who has completed radiotherapy for 3 months take a COVID vaccination?
Yes, cancer patients can take COVID vaccine. It will be less effective since they are in an immunosuppressed state, but it's advisable for them to take the vaccine as soon as possible. Regarding the medications to be started in the first 2 days, as I explained the phases of the illness, day 1 to 6, you need to start symptomatic treatment. So if there's fever, you can start paracetamol, naproxen. As I told you, I'll be sharing a list of medications which need to be started without without the guidance of a physician. The symptomatic medications which are available over the counter at any chemist's shop. There's also another question which is asked by a person, I don't recall, but they have said that how can we, find out if the vaccines are being targeted against the variants since there's a poor record of genomic sequencing in India. That's true, there is a poor record of genomic sequencing in India, but at the national and international level, there are organizations which are sequencing a particular set of patients who are being admitted in national institutions like AIMS, JIPMER. Where I was studying at JIPMER, we used to send, whenever we saw a UK variant, whenever we, find out a contact history of the patient, we saw that one patient came from the UK. We sent his viral sample to Pune, where we have the National Institute of Virology, to sequence the genome, and it does it. We found that the patient we had, the only patient we had from UK had the UK variant, and then they went back and saw if the vaccine was working against it. And yes, so I think last week or some days before that, Dr. Fauci, who is the international authority on COVID in the USA and the most respected immunologist in the world, said that Covaxin is very effective in combating the B1.6.7 variant, which is as they call the homegrown variant, the Indian variant. So yes, there are studies which are being done on all kinds of variants, and even though the rates of genomic sequencing are low in India, they are being carried out at a level on which we can draw effective conclusions.
Well, question number 14, doctor. Should we use oxygen concentrators or should we use oxygen cylinders?
Depends on the requirement. Actually, oxygen cylinders are much more efficient than oxygen concentrators because they provide a higher flow rate of oxygen. And if someone's oxygen range is less than 85 or 85, then oxygen concentrators can't solve the issue. So if you're getting an oxygen cylinder, it's better. But the advantage of having an oxygen concentrator is that you don't have to keep on refilling it, right? So if there's lesser, usually we use oxygen concentrators in transit. For example, if you detect the disease early, the oxygen won't fall as low as 80, it will be around 92, 90. You can use oxygen concentrator to, maintain that and then shift the patient in the hospital.
Well, we move on to the next question, doctor. Question number 15. What about the so-called self-check test kits that are priced at rupees 250? Obviously, there's some anxiety about how good or bad they are. The self-check test kits that are available at rupees 250.
All right, they're just as efficient as the rapid antigen test because they use the same principle. If you do it properly, I've myself done it in the hospitals. It's the same as rapid antigen. They've just made a kit of the rapid antigen test and provided it for use at home. It's very similar to the urine pregnancy kit which women use when they miss their periods. Just the difference is that they test urine. Here you are testing the respiratory secretions. If you follow all the advices, there are many YouTube videos to follow the instructions from. And it has the same efficiency of a rapid antigen test. So you can practically get that and test yourself at home. And if it's showing negative and if you have symptoms, get an RT-PCR done. If it's showing positive, then no need to test further. You can start your treatment and monitoring.
Right. Question number 16, doctor. This gets on to allergies now. I know someone who did not get the vaccine because she had food allergy. I thought it was only for allergies to drugs. Is this also true for food allergies? Not getting a vaccine because of food allergies?
It depends on the level of allergies you have. For example, I am myself allergic to crustaceans, which means prawns, crabs, lobsters. So whenever I eat that, I get a very severe reaction. My lips swell, I have respiratory difficulty. But I think you need to get yourself tested, and every case is different. You have to test, you have to get in touch with your doctor and they can make an informed decision regarding the same. Because getting a vaccine is very important. It provides considerable level of protection against the virus. So I can't be making blanket statements like you can't take the vaccine if you are allergic. I myself have taken the vaccine. Being a healthcare professional, we were supposed to take vaccines in February itself. Covishield, both of them I've taken in spite of having a food allergy. So please consult your doctor. Don't refrain from taking a vaccine if you have allergies, because every vaccine has different components. And basically, you can develop an allergic response only if you're allergic to the components of the vaccine. So you have to, get into that and find out what exactly you're allergic to.
Okay, we move on to the second last question, question number 17. The vaccine is not recommended in pregnancy or people with food allergies. Are there any trials being conducted in this group?
Yes, trials. Not sure about the food allergy part, but yes, trials are being done for pregnant women and lactating women. And I think if there are no comorbidities, we should ask pregnant and lactating women to get vaccinated because they are in touch with infants and neonates. And if they contract COVID, they can pass it on to their children, and that becomes a very bad thing. And that's why they should get vaccinated. And that's a conscious call to be taken by the gynecologist and the patient themselves, discussing the pros and cons of taking versus not taking the vaccine. Yeah, and again, this is just like saying that if how long the immunity is going to last. Only when we conduct experiments and we find the data is when we can give blanket statements like these. But for now, if someone asks me if you can do it or not, you have to get in touch with your gynecologist, know if you have any comorbidities, and then mostly he'll ask you to take the vaccine. But it's not like it's absolutely not advised. In fact, we are promoting it for pregnant women who are otherwise healthy.
Okay, Doctor, the last question now becomes the second last question, as we have some people still asking, but we're going to stop with that. All right, we're going to have question number 18 here, which talks about home isolation. Can you advise the diet and care for patients and families during home isolation? I think you did touch upon this question.
Yeah, I spoke about the medications for symptomatic relief and that you should get isolated as and when immediately after you develop your first symptom. The diet should be what is comfortable for you. Generally we advise food which is not heavy to digest, uh, food which you like eating, because particularly in COVID you lose your taste and you're feverish, you're fatigued. So probably we even ask patients to have ORS because there's a lot of dehydration in COVID. So you can just sip on ORS or any kind of juice. Refrain from having packaged drinks because they have a lot of sugar. Don't have packaged drinks or sodas because they have a lot of sugar and they can worsen your dehydration, in fact. So have coconut water or ORS, even lemon water with some salt and some sugar. That's fine. Diet is, as I told, light food, and very important is have food in dispensable in what do you call it? Like one-time use containers.
Okay.
Don't use steel containers because then again those containers go for washing and then people come in contact. Even though the rate of contact spread is less, you must not take a chance. You don't want to infect your family members. Just use those one-time use containers and dispose of in a proper manner, without avoiding avoid a lot of contact, basically.
Sure. Dr. Akshay, question number 19, which is going to be our last question for this morning. What are the chances of pets? What are the chances of pets contracting the disease, and how do we avoid the same?
Again, I think isolation is very important. I don't know much about this. Again, this is another question which I have to look at the data for and get back to you. But I'll assure you that I'll look into the correct and scientific data and get back to you with correct and credible medical information, just like I'll do for the flu shots. Someone has also asked about the teratogenic effects of the vaccine on pregnant women. But yeah, again, that's what I told you. Things are being studied, and as of now, there haven't been any teratogenic effects. Teratogenic effects are basically effects which can be caused on the fetus if a pregnant woman takes a particular drug. One important thing, women who are pregnant and contract COVID, please don't take ivermectin and doxycycline. Those medications have teratogenic effects. Those are very common medications which doctors prescribe, which I don't think have a lot of data to support. So pregnant women and lactating women don't take ivermectin and doxycycline. They have teratogenic effects that can affect your fetus and your child.
Thank you very much, Dr. Akshay. That has been so very informative, I must confess. Ladies and gentlemen, for those of you who would have liked to listen to the entire talk yet again, it will continue to remain on the Catholic Gymkhana YouTube channel. You can visit the Catholic Gymkhana YouTube channel, access this particular program, and listen to Doctor all over again. Get all your questions answered again through Doctor through that recording that would be available. Ladies and gentlemen, we now move to the very last part of this morning session. It's my pleasure and my privilege to call upon one of our managing committee members, Mr. Ian Pereira, to propose the vote of thanks this afternoon. Incidentally, ladies and gentlemen, Ian Pereira is the one who gets you the posters week after week after week for the members' night, as well as for the talk that has begun this week, of course, the virtual talks, and will continue every month. It is Ian Pereira and Yvette Malgi who look after our PR team and who bring you all of these lovely posters. Without too much of a fuss, calling upon a managing committee member, Ian Pereira, to propose a vote of thanks, please. Over to you, Ian.
Thank you, Sanju. Very nice talk, very informative and very well presented, and therefore means a lot of thank yous, because a show like this is not easy, a live show. First, thanks to the managing committee and Vernon especially for giving us the go-ahead to go ahead with this program. He wanted it last year, but with technology not so advanced, we had to delay it. But hopefully we'll carry on every month. Doctor, what can I say? For a young man, so intelligent and answering everything so nicely. And also, when you don't answer, you refuse to answer. That's a very nice thing. And the slides, the presentation was excellent. And for those with a keen eye, they can see medals hanging behind Dr. Akshay on his wall. Those are all something to do with medicine. So, Doctor, I think you need to buy a cupboard soon. So you'll need more help for this. But thanks once again for this wonderful, wonderful presentation.
My pleasure.
My pleasure. And of course, our great moderator, Sanju Fernandez, who's also on the managing committee and is the treasurer. Very difficult job that he handles. Besides that, he's got his own training and consultancy business, but also moderates, compares weddings and corporate events. But I think Sanju will admit this. I think this is the first show he's done almost like a live television show, and he's handled it so well, so very well, that compliments to you, Sanju. And of course, sitting in Pune is our tech expert, Aubrey. And Sanju mentioned 19 questions, but there were more than 19. There were more like 40 questions. But our friend Aubrey has compiled the common questions into one single question and sent it to what Sanju called his control room. And his control room was none other than his wife Nirmala and his daughter Grisel. Thanks to them for their support in passing on the questions to Sanju. And again, we've had quite a few viewers here. And to get viewers, you need good communication. Thanks to Yvette, who's always on the ball, spreading the link everywhere. And Vernon Arona, who has a database of churches and has passed it on to parish councils. He's also connected with associations in in Canada and America, the Goan associations, and sent the message there. So that's what we've done. So overall, a good, very, very good show. And thanks once again to all those involved. Thank you, Doctor, once again. And
I'd like to thank Mr. Ian Pereira for approaching me to, and providing this wonderful opportunity to interact with so many people for a topic which is so important in today's, environment. And I hope people have benefited from this and implement this in their daily lives, because it's very important to implement things, not just listening things, and take the correct and follow the correct medical advice so that you and your family are safe from this dangerous pandemic.
Thank you once again, Doctor, and back to Sanju.
Thank you very much, Ian Pereira. I must say and confess one thing, Ian, that was a very, very comprehensive thank you. You spoke like a compere yourself. Maybe we should switch roles. You're a professional photographer. Maybe I should get into photography and you should get into comparing as well. Thank you once again, Ian Pereira. Ladies and gentlemen, I'd like to remind you that we will see you all for yet another program like this on the 20th of June, 2021 at 11 a.m. sharp. I also like to remind you that every Saturday, week after week after week at 9 p.m. sharp, we have the members' night with a live band from across the country. We've had viewings from India, from Sri Lanka, from Australia, from UK, from the US, from Burma, from Muscat, and I can go on and on and on. It is indeed an experience to be with us at 9 p.m. every Saturday for the members' night. Thank you so much. Before I leave, ladies and gentlemen, before I say goodbye, I like to leave you with a very important thought. Think about it. It's not the hospitals. It's not the oxygen. It's probably not even the vaccines that will determine the future of humanity. It is only the behavior of people which will decide the course of this pandemic. With that, Thank you very much. Goodbye and stay safe. Yes, please go on, Dr. Akshay.
So if anyone faces any kind of symptoms regarding COVID and recognizes day one, is confused about anything, I'm available to consult. I do my free consultations for COVID patients from 1 to 3 p.m. Every day, and this is over WhatsApp. So you can just text me on WhatsApp, and I do it for free from 1 to 3. Me and my and there are a set of 100 doctors who do it like from 8 a.m. to 12 at night. So there's another chart where time slot wise we have divided our hours and we do it. So my time slot is from 1 to 3. If you wish to connect with anyone else, and all are very good physicians, I can share the list of doctors with Sanju, and then he can forward it to you.
Thank you so very much, Dr. Dr. Akshay. That was very, very gracious of you, in fact, to have offered your services free of charge from 1 to 3, where people can come across and sort of consult with you online. Thank you so much indeed. We will pass on all of this information to our public relation team with Yvette Malgi and Ian Pereira, who will take charge of that and then disseminate that information to everybody. As I said, let me leave you with that thought yet again, ladies and gentlemen. It is only the behavior of people. It is only the behavior of people which will decide the course of this pandemic. Thank you. Goodbye. Good afternoon, and stay safe.